I've read hundreds of books, at least 1 or 2 books a week, and just trying to understand the subconscious. And there's an event that happened years ago. I will never forget. I got called for a patient having an epileptic event. He was having seizures, and I was at home at the time. And I got called from the nurse that this particular person was having multiple seizures, and they were giving him medications, and he was breaking through. And I said, "That's very strange that he's not responding to medication. I'm 5 minutes away, so let me run over." I run over, and I walk in there, and there's a crowd of nurses and respiratory therapists because they're about to intubate him. And I stopped right there, and the nurse comes right up to me and says, "Doctor, what do you want to give him?" Now, I didn't even examine the patient. She's already asking me, what do I want to give him? And I said, "We need to give him love." And it was a very strange reaction because I'm not sure why I would tell that, because I'm walking in the room and the person's having seizures and I want to give him love. And I go in there, and the seizures and the movements are very typical for seizures, and it was likely a psychological reaction. And I said, "I don't think these are seizures." And one of the nurses said, "I have it on video. Let me take a look." So she comes over, I go outside the room, and we play the video. You can see by the movements that they were not epilepsy. They were arrhythmic, abnormal movements that were not epilepsy. So you can get away with what they call pseudo seizures or non-epileptiform seizures. Those are seen in patients that have suffered psychological stressors, traumas, and experiences in the past. And I can see him doing movements, and he's got a tattoo on his arm. And in Hebrew, it says ahava, and the word ahava means love. And I said to myself, "Oh my God, that is the craziest thing." I said, I thought about him, like, there's not a coincidence here. Now, is it subliminal? Whatever it is, you have to understand there's so much that goes around us that is under our level of consciousness. If you're not aware, we're just like robots moving around doing the same thing over and over again. The amygdala learns by association, and it's our protection. There's actually several nuclei or segments of the amygdala. This almond structure has a lateral segment, a central segment. The lateral segment is that segment that has the storage to the experiences and events and saves you that way, and then can act on the central part of the amygdala, which fires that sympathetic discharge to the hypothalamus, from the hypothalamus to the adrenal cortex, and from the adrenals fire the adrenaline. And then before the amygdala, it usually goes through the thalamus or through the visual cortex. So, but even before you're able to visualize something yourself and see it, your amygdala is reacting. So that's why, like, when I was talking about your subconscious, your brain already is processing stuff under your level of consciousness. So when I walked in the room and I saw that patient, my cortex saw it through my thalamus and then worked its way into saying something, because that was under my level of consciousness, and then become aware of it. It was like, oh, well, look what happened. And it made sense out of it. So that's why, you want to bring these things out of your subconscious into your consciousness. Now, so the lateral part is more for recognizing patterns, and it recognizes it through your senses that are traumatic or experiences, or recognizes in generalization. So let me give you an example of like a generalization. Well, I have a patient that has a fear of Pomeranian dogs. And I said, Pomeranians? He said, well, I got bit by a Pomeranian. It's the most amazing thing, because these are learned impaired events. We're not born with the fear of dogs. Now, I grew up with no dogs, and my parents, specifically my mother, was afraid of dogs and told me that dogs, bite. And I did have some fear of dogs. I have dogs. Actually, all of our brothers, my 2 brothers, we all have dogs. And our patterns have changed over time because, we've been able to recognize it, bring it out of our conscious, look at patterns that dogs are safe, and actually dogs are great, and they're emotional animals, and they really help with emotional support. But you can understand that our brains wire that we're told or we've had experience to fear dogs. Now, you know that it's acquired. Fears are learned behaviors, and some of them are irrational. What are big irrational fears in my practice? A big one is claustrophobia. So I order a lot of MRIs, and they didn't open MRIs based on 5 people. The minute I even mention or anticipate mentioning MRI, I can see their body language change, and that sympathetic nervous system is discharging. Just even mentioning the word MRI, closed environment. It makes no sense going to MRI. I don't think anyone's ever died in MRI that I know of based on claustrophobia, but the irrational fear of the feeling of being in closed space has caused that person to avoid closed spaces. So once you avoid, your brain starts repetitively through habit avoiding closed spaces, and the problem becomes bigger and bigger and bigger because you're reinforcing the fear. Now, something must have happened when they were younger, usually before the age of 7, or something that was acquired. If you really look at patients that have anxiety, they feel unsafe and unsecure. The alarm system is going off. That means you've lost a sense of safety and security. And that triggers our nervous system to react in a fashion. A lot of us don't have those tools to understand it. We don't even see it. And we just start automated behaviors of those patterns over and over and over again. So it's so important to be consciously aware of our surroundings and of life, because you don't want to get to a certain age and be like, oh my God, I wish I could have done this. I wish I could have enjoyed life. You want to live a very happy life and you want to be very consciously aware. Fear is protective. But when you're more in protection and less in growth, that's when you get into problems. And that's why it's important to start learning how to reprogram, rewire. They call it neuroplasticity, shape your brain, because you want to start paying attention to all the amazing things in life. So I'm going to give you an experience of something that happens to all of us and how with fears and how we process fears. So I'll never forget, on my honeymoon, I went out, and I'm a water guy. I love the water, and I'm consider myself a very good swimmer. I remember jumping in the water. There was a riptide, and the riptide took me in a way, and I did exactly what you're not supposed to do. I panicked, and I attempted to swim out of the riptide. And I fatigued, and luckily a diver was there, and I was deep in the water. Shore was just far away. Came swimming over, and he got me. And I was like, oh my God, I'm a great swimmer, but I couldn't do it. I was just fatiguing. So that experience wired in my amygdala. Now I'm just avoiding it. How can I live my life doing this? So I actually took a video and I watched riptides, and I was looking at how to get out of riptides, and even the best swimmers can get stuck in a riptide. And I actually scientifically understand riptides. And the one thing about riptides is let the riptide take you and swim parallel to shore. And that's exactly what I talked about anxiety, is don't fight it. Allow it. What was I doing? Fighting it. Let it take you. And with time, you're going to be okay. I actually purposefully went out on a very windy day, and I was very confident that I would be in a riptide. And guess what? My amygdala retrained riptides. We're good. Actually, a part of me wants to save so many riptides, so I kind of like hang out on beaches sometimes just to see if I can do it. Is that I trained myself not to be afraid of riptides because it was starting to affect my life. I want to give you personal experience on that, because then you understand that, you're not alone of having a fear, because we all have fears of something. Because we don't, that's how it is. And what the fear starts affecting your daily life or taking away things that you once enjoyed, then you need to seek help. And it's not just about medication, as you can see, because how is a medication going to help me with my anxiety reactions to these things? It just doesn't. It's okay to have that feeling. You gotta want to be that witness of it. It's a feeling of doom. But when we get into the attack, you have to understand that the attack, it always goes away. It does with time. And you'll see, if you start timing it, your first panic attack could be 20, 30 minutes. And then, you know what? I say time it. Next one, 10 minutes, next one, 5 minutes. So once you start timing it, you're going to be like, okay, yeah, I'm floating through it. I'm not fighting against that riptide. I'm allowing it to pass through. And with time, it goes away. And it sounds so easy the way I say it. And I'm telling you, it's not as easy, but it can be with repetition and understanding how your nervous system is working to experience this, because we all have had some feeling of panic. And when you can observe those feelings and sensations, then you become consciously aware of it. Again, that is your step to recovery. And then feeling it and allowing time to pass, because you want the time to pass, because it will pass. Panic attacks usually can occur on sudden, unexpected. Now, how do they come about so much? Is because when you're in a sensitized state, so those nerves are just sitting around waiting, and boom, sensitized. Fear, adrenaline, fear, tension, tension, tension. more adrenaline, more fear, more adrenaline, more avoidance. And you're in eternal shock. You don't want anything to sensitize yourself. You don't want anything to cause you to feel those symptoms. So you're avoiding those symptoms. I don't want to throw up. I don't want my heart rate to race. I don't want to feel short of breath. The word I don't. And let's take a step back and do the opposite. And the only way to address it is to start facing it. Now, when you're in a sensitized state and you're eternal shock, you don't want to hear that. So you got to be careful how to approach someone like that or a patient like that, because their logical, creative mind or even their thinking mind is shut down because their limbic system is so much stronger that their logical brain is not working. So you can't talk somebody out of it. You got this, you're going to be fine, it's just a panic attack. So what you want to do is you want to support the person and then get them into feeling it and say, let's just wait it out. And because if you start telling anybody, a spouse, a patient, anybody, two things that will trigger possibly an anxiety reaction is number one, calm down, and number two, relax. Those two things could be the worst advice I've ever heard. When you start doing that, you're putting the command on somebody and someone doesn't like to hear that. You have to be very gentle on the way you do these things. And you have to have compassion towards somebody with anxiety because it's not a sign of weakness. It's just a sign that your sympathetic nervous system is on overdrive. You need to activate your vagus nerve, your parasympathetic nervous system. Your worried brain, which is your prefrontal cortex, what's that in charge of? Well, that's in charge of your rational behavior or your rational thinking, your creative mind, your instinct, your cognitive memory, and your thoughts. So your thoughts are being triggered all in the front of that brain. And then you have the amygdala. And I told you before that the connections from the amygdala are so strong that they take over and hijack that part of the brain. So you want to be able to pull yourself out, be mindful, and be present. My goal is to really teach not only us as patients, is to actually teach professionals how to approach a patient through understanding the anatomy. You don't have to be a neurologist, but connecting and discussing and learning all of these pillars of health.